Hi, everybody. It's nice to be back. I want to say a few things. The last few couple of months have been kind of hectic and been a little bit short, and there's a paucity of videos. I apologize about that. We're going to continue with all of the video series that we've been making and the type that you like about particular substances, their pharmacology, and so forth. We're going to try and expand this and be quite regular. And one of the areas I would like to expand into is first, let me tell you a little bit of background about what all of this is and how it's come to be, and my understanding of what we're doing here. First of all, it's my view on addiction as a disease. And please don't take that in any kind of categorical sense. A disease, a clinical disease, my view on addiction as a clinical disease, it's nothing more than a construct and a framework for me to be able to have predictive value in the actions I take, which means this. If you're on opiates for a certain amount of time at a certain age with certain demographics, and I put you on this medication, the likelihood I'm going to get an outcome is A, B, and C. That's all I mean by disease. But all of it together, the goal here for me has been to present to you a clinical model of addiction, an approach to addiction, and educate you about all of those, because I think what we have done with this program, with this channel, is amazing. We have really empowered, enabled, educated, reached out to many patients and clients, and that's wonderful. My overall background, for those of you that have been watching, sort of the intent of where I'm trying to go, and you see some of it, is I don't look at this as a complex physiological event that just needs to be addressed with medication. This is a complex disease. And if you even look at the definition of it, it's kind of interesting. The clinical definition uses the term mental, spiritual, psychosocial, and that's really profound if you look at the formal definition of addiction. And in all of our programs that I'm involved in, myself and the whole team approaches it in that way. And we try to approach it not just in a professional way, understanding the full complexity of disease, which means it's not only a physical issue, but it's a psychological issue, it's a social issue, and we really haven't got into that so much, but it's also a family issue, a relationship issue, a trauma issue, a childhood issue. And the clinical approach really does take all of those into consideration. Thus far, and will continue to do so, we're just sort of touching the tip of the iceberg by trying to bring down scientific-based evidence of how you treat this disease, translate it into really basic language, share that with the viewer, whether it's a user or family or friends, and we think we can get a long ways with that. The other part of this disease that I hope this part of the series really starts to address is the mental health component and how critical that is in addressing the overall complex thing that we're dealing here with. And to that end, I have brought, we call him Dr. G. We have Dr. Garajade, we call him Dr. G. The both of us, he's a licensed clinical psychologist, and not just addiction and substance abuse, but family counseling, family therapy, and a whole bunch of other stuff. Our relationship is we do work together. He in one of our programs and across the board in all of the things that we do, he really runs the mental health component of the things that we do, and I run the medical component of it. And I thought it's a great time, since you've sort of been immersed into really layman's pathophysiology of addiction, to bring him in and sort of kick off and begin a series that hopefully leads into the greater complex picture of what addiction is, including mental health, psychological, social, and systemic in general, which is what I'd really love to get to. So Dr. G, welcome, and thanks for joining us today. And we said we'll keep it light today. So,
Yes.
But thank you.
Thank you, Dr. B, for your introduction. Thanks to the audience for having me here as well. So, with your permission, I'm just going
Please.
to speak to the audience first and foremost that it's been a pleasure working with Dr. Banimad, Dr. B. We all go by initials, and usually, by the way, I have my very special fedora on for my branding purposes, but I'm going to put it aside for now. And the reason, really, it's such a pleasure for me to work with Dr. B is that, in my opinion, he gets it. Not many people get it in terms of when it comes to addiction. I know it sounds a little bit condescending or a little bit hubris. I don't mean it that way. It is literally about getting what I call a systemic perspective. I always use that word, in terms of the understanding of complexity. Dr. B kind of split it into the component of it, right? The social, the functional, the medical, individual, relational, mental health components. But so it is really for the first time that I have seen a physician, addiction specialist, conceptualize and understand the entire complexity of addiction, and yet be able to, as he mentioned, look at the physiological component of it with such a simplicity and ease. Not that it is simple. I think he make it sound simple. It is super extremely complex, but that's why he's brilliant at what he's doing, because he can just simply understand that complexity that most of us are struggling with even understanding, and he can treat it well. And especially, I would say, I would want to add the fact that the era that we live in, maybe 20 years ago, 50 years ago, things were completely different, where people could deal and handle addiction from a little bit of a, I would say, different angle or perspective or methodology. But today's phenomenon that we call addiction, and we see it happening on a daily basis, that leads to so many overdoses, basically death, that everybody is having a hard time accepting or even living with, requires I would say, a dual approach. Both, as Dr. B was saying, a mental health, I would say behavioral, if we can encapsulate that within behavioral approach, but also that medical approach, but not for a short term. What we see, and I look at it as a disservice that is being done with most addiction treatment centers, is that they literally almost distance themselves from that responsibility, the obligation of including the physiological aspects, and they delegate it to outside providers, or a very brief duration of time, like for a few days, a few weeks, but they don't look at it as a long-term treatment. And most of it, I would say, goes back to the lack of their own expertise. Probably that's why they don't understand it well, therefore they don't treat it well. And this is where I have seen Dr. B done an amazing job, because he actually educates the patients. That's what I have seen working with him now, that for a few months, that he literally kind of transitions the client from a lack of awareness and confusion and being completely lost, to a level of more or less tangible understanding that the patient himself or herself can hang on to in their recovery, on their path to full recovery. And that's rare, because if you have probably noticed that from different addiction treatment centers, and or let's say family members or yourself, if you have been addicted, is that most clients / patients, they don't even understand what's happening to them, and that is, I would say, the biggest disservice that's being done. And Dr. B does a fantastic job, transitioning the client from lack of understanding to understanding, which in my belief brings empowerment. That's huge, and that's what I hope to do in terms of the mental health component. Now, the way I look at it from mental health component, and I want to turn it back to Dr. B and get his opinion and input on that, is that the way I see it is that mental health is unfortunately looked at as a isolated, separate component from life, as if some people have mental health, some people don't, which is just paradoxical. It doesn't make sense. Mental health is just paramount. Every human being has mental health, and we're talking about mental health, not necessarily pathology. Now, pathology would be if you will, an impairment on a spectrum within the mental health. Now, if we understand that correctly, then we would also be able to conceptualize it from, again, that systemic perspective, meaning we can't exclude mental health from family relationships. We can't exclude mental health from work relationships. We can't exclude mental health from physiological understanding and functioning of our body. Because somebody who has, in the right mind to take care of their body, they certainly should be in the right, mental health state, if you will. Be able to make good decisions, in other words. That's bottom line to me. Mental health is people who are able to make good decisions in their lives. And now certainly, given the ups and downs and setbacks and failures and so forth, there are lots of nuances. So to bring it back together, and this is what I want to ask Dr. V, what he thinks about it. I think addiction treatment has to be comprehensive. It can't just be one thing, like just attend to this and then you're going to be fine and hopefully, you get over it. No. And what I mean by that is this: if somebody has cancer, right, and would it be reasonable to just kind of treat a person's, let's say, I'm going to use the analogy of limbs, right? We look at one hand and say, okay, this is cancer-free, we are fine, and then we see you in a week. Not knowing that, well, those cancer cells or whatever it is that's going on in them may be hiding in another part of their body. So if you use that analogy of different limbs, that's how I look at people who have addiction. Yes, maybe they go to work and they're functional addicts. There's nothing going on in their work. But are we looking at their romantic relationship, their partner relationship, their relationship with their kids, their relationship with their parents? That's just one example of that multiple limbs or systemic, different components of the same system. If we are just making them functional enough to go to work, but not working on their relationships, we are doing a disservice because we really just are fooling ourselves. I just want to leave it at that introduction and get your ideas, Dr. B, how you.
I'm hoping there comes a time where we've made every video that has to do with pathophysiology, pharmacology, and behavioral issues, so I can actually talk about this, because this is what I actually enjoy. Yeah. So I'll try to be brief. So here's my opinion. That which people think of as physical health lends itself to that which we can broadly describe as mental health, and that itself is feeds into what I'm going to call social environmental health, and social environmental health feeds into mental health, which will feed into physical health. I'm going to leave that one at that to show how important and interrelated they are. I'm going to move to another analogy to sort of point out how important this issue is for me, and that's what really this is all about. That's what the concept of harm reduction is about, is respecting the physical, the mental, and the social human being that you're dealing with to kind of get them back to recovery. But I'm going to bring another analogy. Much of our medical practice, mental health practice, public policy and health policy is one of punishment and of judgment. And there's no other area where this is more pronounced than substance abuse. Right? Let's look at the rise in incarceration in the early 90s with the, non-violent offenders, substance abuse. These guys are getting long-term. And so I will say this: if I took a gram of heroin, or if I took a pack of cigarettes, and I put it on the table, our social paradigms are so strong people have this sense that there's something evil inherent and intrinsic in that gram of heroin. Okay? There isn't. And in fact, when you think about abuse potential, physiological dependence, addiction, I'm going to say that I can take the same substance, let's say cocaine, and then coca leaves. And if we come in a Western industrialized society, it's one of the most highly addictive substances. Yet when we go into the indigenous populations, it's been around, and I'm sure there's events of abuse because that's the statistical variant of nature. But for the most part, it's judiciously used in an appropriate way. It's no different than your opiates and heroin. And then you ask, well, why is that? Well, the only reason why that is there's this mental health thing, which is influenced heavily by your social and environmental health, and the three of them go back and forth. And so you're like, oh, okay. And then there's another issue, historicity, time, development, adverse childhood events. And so then you start adding on layers and layers. Your family, your relationships, how those were developed. Then you go into institutions and systems, right? Then you go into the incarceration industry, which is what I'd like to call it, and the political economy of the society you're in. And so all of these, one of the manifestation of this broader social pathology is substance abuse and addiction. And so I always tell my patients, if you come to me, a monkey can write you a prescription for Suboxone or whatever. I'd like to think I'm not a monkey. Once I give you that, it's very important and maybe the crutch of getting us going in the right place. And we will get somewhere by just getting you that. But so can I by making my table that's broken and putting a piece of tape on it. It's not going to fix the issue. And I've always had this issue. I can think of one client when it took me 2 years to get him clean. Polysubstance, he had been to 30 treatment programs. And in fact, his picture's on the wall outside. And one day I was sitting there and I was thinking, wow, this young man, what am I sending you back into? Into the same household that had the same environmental setup, that had the same confounding factors and contributory issues that made you a methamphetamine and heroin addict at the age of 13. Yeah. Now I've got you clean in a very, very monitored, regulated environment plus medication. You've been living in my program for 2 years, and I'm supposed to send you back out there in the same dysfunctional, pathological environment. And I would say that goes to greater society at large and tell you, go prosper and do well. And that's always bothered me and sort of kind of instigated my reason. Part of this channel is I would like to get it to as many people to make as broad of a change as possible so we can beat this thing and many, many other social ills. So that's, in short, that's my thought on the importance of mental health. And as you can see, it's much broader than that for me because, people need tools. And those lack of those tools is what got them in this situation in the first place. And I think we are trying to change that and address it with the tools that we have, and we're short on tools.
I want to add to that. I want to add to what we said in terms of an example. For instance, today a patient called and he was saying something interesting. They were saying, I have a good life. I have a good relationship. I have a kid. I'm working full time at my own company, in fact, and everything going well. But once in a while, I know that just my life gets out of order. It becomes completely chaotic. So jump into this abyss of drug use, of self-medication, of just kind of checking out from this world. And that's why he was calling in to get help, and that's what I believe that we actually can be very helpful, because what really stands out here is the core issue to me a lot of times is this sense of purpose purposelessness, meaninglessness of unfortunately the life that we live. Because despite all the accomplishments, material things, I would say superficially fun stuff around us that keep us busy, most of us can kind of really admit that at times we feel this void. We feel this, sense of meaninglessness. Why are we doing the things that we are doing? Everything becomes meaningless suddenly. And those are the dangerous moments. And this guy was literally just describing it. And he was able to actually pinpoint that. I asked him, like, do you feel like that? That maybe sometimes when you're going into that abyss, like life is meaningless? And he says, exactly. I have everything, but at some point of time, I feel like I have absolutely nothing. And he loses himself. And this is one of those perhaps extreme cases, examples of addiction. Maybe not the typical one, but I to me, there is not much a difference between this example and another example, because they all revolve around that core void and sense of literally just loneliness that a person feels in this world, and then well, there's no difference between using or no using. There's no difference between living or not living. In fact, I believe that's also correlated to suicide when people take their lives. Literally, for instance, a good example comes to my mind is Robin Williams. Many times people say, wow, this guy with all his accomplishments, somebody who was like a beloved actor worldwide, and he must have known it, right? And he had everything that really a lot of us wish we had, but then suddenly he takes his life. Why is that? So and that's a core issue for me. That's really something I believe that deserves some attention, and I make it a point of my life, literally, and my career in helping people get there, as quickly as possible. In terms of what I mean by there is that empowerment that I mentioned earlier, where they can actually take themselves to that level of purposefulness and meaningfulness in life. There's a whole, very long drawn research and thousands of books perhaps and theories that have been written about what we call existentialism, which is a long drawn discussion. We can talk about it later. But many people have described life as something that is by nature kind of meaningless. And the antidote to that being the fact that human beings actually give life meaning. And a lot of times this is what drives me in my ways of dealing with people, with my clients, in that empowerment, helping them recognize that every human being is actually capable of that if they wish so. And I think that's a core part of my treatment philosophy with people, to come to that realization. Where is that ability in them? They may have lost sight of it, but there is that ability. I think that's a core component of being human, is that choice as well as ability. Now, sometimes we lose sight of it, but if we can regain sight of that, then life starts making sense. And once you do that, there's no reason to use anything. No self-medication can compete with a sense of meaningfulness in life. So I want to, again, Dr. V, I want to get your opinion on that.
What I would actually rather talk about instead of pharmacology of buprenorphine is this. So I know you're familiar with it. What you described, and it can be described in many different ways. It's anomie. I think A, N as in Nancy, O, M as in Mary, I-E. The first guy that coined this term, and the term is very old, but in modern sense, his name is Emil Durkheim, and he is the father of modern, you've heard me talk about him before, I'm a big fan. He's the father of modern social theory. He was the first guy to formalize the theory of sociology, and the treatise that he did, which is fascinating, I might have a copy here, was on suicide. And in there, he discovered no matter what social strata you're coming from, what financial strata you're coming from, what ethnic strata you're coming from, so female, male, whatever it is, where people are driven to suicide in all of those strata is when there's enemy, and we can call it meaninglessness, right? And another sense is an existential crisis, which I think there's an epidemic of. And this is fascinating because when you start to look at other theorists and some applied research guys in different areas, political theory, economists, psychologists, what we have by the technological advancement of our society in the last 120 years, and again, I'm not saying technology is bad, just like heroin, technology is neither good or bad, but the political economy and the environment that creates and breeds is individuals without any connectedness, purpose, or meaning, and quite a bit of isolation, which leaves you with a life without any meaning, right? And now theorists all over the country are coming out with papers that really show that increases anxiety, depression, and substance abuse. And so, you kind of led into it, and we didn't discuss any of this, but you're going into my real interest. And so I go back to the same thing. How am I supposed to send that young man that I spent 2 years creating a very professional but warm and nurtured bond with to get him out of his substance abuse, to send him back into the very thing that caused the disease in the first place? And so one of my answers was, we're going to work towards a paradigm shift. And I think we do that all across the organizations we work with, because, I can give you the Medicare. And in fact, the reimbursement system, the way it's set up, it's not set up to take into consideration the chronic care and bonding, emotional, behavioral bonding that's needed for getting people to recovery. Take one issue, benzodiazepine addiction. I've made a couple of videos about it. My patients know what I do with that. I will do anything from a few weeks to a few year taper, right? And so the payment systems aren't set up to compensate for that or absorb that, and most people look at you like you're crazy, but the clinical literature tells me that's what I'm to do. And then the social, political, economic literature that describes mental health tells me that's what I'm supposed to do. And you kind of nailed it. And that's my thoughts on that. I think that meaningless and so it's cool. Yeah, I like this stuff.
This is interesting in terms of, I think for the audience that are listening to Dr. B, I certainly want to be continue part of this. That's why I'm joining Dr. B's effort and movement, and this is kind of really get much bigger, I believe, because there is a much grander vision at play that Dr. B, I would say, haven't really had time to apply it and implement it, but he's getting there, and I want to it's a big honor for me to be part of it, and in addition to that, I want to add the fact that I believe there is a great benefit for all the clients that you guys that have come to Dr. B, and the reason for that is that you want to have a clinician, a addiction specialist who understands conceptually all these multiple aspects, which are kind of look at it more like periphery, and understand how to literally hold your hands medically through this journey. It's almost like, again, analogy, I love analogies. It's like, let's say you're walking through a tunnel. It's dark. At the end of the tunnel, there is a way out. You're supposed to go through this to get out. There are a bunch of threats, whatever it may be, whether it's wild animals or diseases or even just kind of stuff impeding your way, like trees and branches or whatever it is. It's like really this crowded place, a tunnel that you're trying to find your way, and you want to work with somebody who's been there, who knows how to pull you through this journey through this, the trials and tribulations of walking through this very terrifying experience, and not worry about whether or not you are doing the right thing, not being influenced by misinformation, which we are surrounded by all the time. So, and that's what I believe Dr. B is doing, especially, again, that medical knowledge that he brings in, because like he said, there's some of the stuff that a lot of people may disagree with him in terms of the like a 2-year taper or whatever regimen that he puts people on. But the reason it works is, again, because he knows the complexity of this journey. And that's a very comforting experience to have. Like, I would want to be in the hands of such a clinician to know that, wow, I can just kind of relax and turn over the treatment to the expert. And this is the hallmark of addiction treatment, right? The person who is suffering cannot be in charge of their treatment, literally. They got to turn it over to a specialist, an expert, and relax and actually do the work, but not guide it himself or herself. So I think that's what you're getting from Dr. B, and that's why I'm also very honored to be part of the program. So that's all I have to say for now, Dr. B.
So thank you for your thoughts. And it took me a couple of years to get Dr. G on board because, and I've been searching for a clinical director for quite some time. And so thank you for all of that. What we hope to do with kind of this part of this series, and I'm really going to be on top of things. I think Dr. G is going to force me. That team is going to force me. We've come a long ways. We're going to sort of develop a whole series around this. In terms of that, please leave your comments below. Tell us what you think. Give me some feedback as we try to develop this area. In addition, I'm going to try to start putting aside some time to really interacting with you guys. I've been kind of off for the radar for a couple of weeks, so I apologize for that. But the more feedback you give us, we're kind of putting a new thing. We're going to take all of that and definitely respond to it. That's what we've done all the time. Other than that, our usual series and videos are going to continue. I still have some work on methamphetamines. If you do like this video, please click right above to my left for other videos like this. And if you like the channel and the content, please press the subscribe button and the bell, and I'll see you guys soon.